the Triple Towers of Power. The mighty 790 News Radio. KFGO.
Got to admit, it's getting better. A little better all the time. I have to admit, it's getting better. It's getting better since you've been mine.
The mighty 790 and 104.7 KFGO. Good afternoon. Welcome back to The Drive. KFGO time coming up on 4:10. I'm Dan Michaels, your host. Paulie Lyons at the con. Mr. Juergens of the KFGO News Center. Wondering what's normal and what's not when it comes to getting your virus vaccine? Does a severe reaction predict how you'd react to the actual virus? And why do some people have a reaction and others don't? That happened in my own house. I hardly had a reaction. My wife got sick both times. Experts say side effects are either a physical manifestation of your body's immune response or an allergic reaction. Well, let's find out about that, and let's ask some other questions about the vaccine as well. We are very honored to be joined this afternoon by Dr. Anna Wald. Anna is head of Allergy and Infectious Diseases Division, professor of medicine, laboratory medicine, and pathology and epidemiology at the University of Washington. And she has graciously given us a couple of minutes this afternoon to talk about the vaccine. Good afternoon, Dr. Wald.
My pleasure. Thank you for the invite.
Thank you for having me. So let's jump into those side effects right away. Just in my own life, I had both. My wife and I had both the same vaccine, Moderna. I didn't have a reaction at all. My wife got sick both times. What's that mean?
Well, it means you're two different people, right?
You can tell by looking at us, too.
Exactly. So I'm not surprised that people have different reactions to the vaccine. We also know that people have different reactions to actually be infected with COVID-19. So these reactions represent the fact that the immune system is seeing something that's foreign. So it's the foreign protein that belongs to the virus in the vaccine, and it responds to it. And sometimes it sort of goes overboard, and that's what makes us feel ill. It's not uncommon that vaccines have those types of side effects. In general, these vaccines have, I think, somewhat more severe side effects than do most of vaccines. But they're still, for most people, pretty bearable. And, you're protected. They're incredibly effective in preventing death and hospitalizations.
Dr. Anna Wald is joining us. Among other things, she's the head of Allergy and Infectious Disease Division at the University of Washington. We're talking about the vaccine again today, and there's lots of people that have objections. So before I leave that subject, though, Dr. Wald, does your reaction to the vaccine have any correlation to how you might have reacted if you would have caught COVID?
That's a really wonderful question, and I don't know the answer, and I don't know that there's a good way to respond to it, right? Because if you get the vaccine, then you're very unlikely to get the infection, and if you have the infection and you survive, then your immune system is already primed, has already seen the virus, so it will respond to the vaccine differently if you have it after the infection. So I think people who have bad reactions can take solace and think, oh, yes, my immune system is so strong. It's doing such a good job making that strong antibody response.
Yeah, amen to that. So what do you say? Now, there's a whole bunch of people that have so many objections. What do you think of incentivizing the deal? I'm sure you might have heard some of this, incentivizing the vaccine. Get a free beer, a beer and a shot. That's an actual promotion out there. Some places are saying we'll give you $100 if you get the vaccine. What do you think to incentivize getting the vaccine?
I don't have any problems with people being incentivized. Whatever works for people, get vaccinated. I think we're seeing this already at universities and colleges, that they will be actually requiring the vaccination before the students come back in the fall. And I suspect that there will be businesses that will also start requiring it. So if people want to make the deal a little sweeter and offer an incentive, I think that's fine, whatever it takes to get people vaccinated.
Dr. Wald, you just touched on something I wanted to ask about, too, because there is great concerns that private businesses, cruises, airlines, other schools are going to have restrictions. If you're not vaccinated, if you can't show me your vaccination card, you don't get to participate. What do you think of places having restrictions like that?
Well, I mean, I think if you're for choice, you can't have it both ways, right? These are private businesses. So it seems like they should be able to make their own rules. Restaurants have no shirts, no service signs, right?
Yep.
Maybe they will add a no vaccine, no service sign.
We have talked about that over and over and over again along the same lines as well. There's a lot of people who don't want to go down this road. They say the vaccine did not get FDA approval. It's 98% survivable, et cetera, et cetera. What's your response to people who stand up to you and say things like that?
Well, I think that's a really interesting way and a very self-centered way of looking at it. So yes, only, let's say, 2% of people who get this infection die. But we also have had more than 500,000 deaths from it, right? There were more deaths in the United States last year than in any other recorded year before. So, I think everybody now knows somebody whose family member died. I know several people who lost family members to COVID. And those people who died, their risk of death was much higher than 2%.
Mm-hmm.
Right? So it's not just about you and you being able to survive. It's also about you giving it to your grandmother or you giving it to your close friend who has cancer and cannot mount an immune response that's appropriate. Right, so we share the air, right? We share the atmosphere, we share society. So we have to act responsibly.
Dr. Wald, there are those who believe it is a political issue. There are those who believe that they should not have to get this vaccine. They shouldn't have to wear masks because it's against their personal rights of freedom, and that only liberals wear masks and only Republicans don't. What do you think of the politicalization of the COVID virus?
Well, I think it's one way of looking at it, but, I'm a scientist, so I look at the data, right? And it's pretty clear that masks are effective. There are a lot of good studies now showing that in places where mask wearing was required, there were many fewer infections and fewer deaths. The places that closed, gathering venues, people's lives were saved because of that. Yes, you were not able to go to a bar and have your beer at the usual place, but you saved a life. So I think people should feel good about being able to follow these, I think, pretty mild restrictions on our freedoms in order to, save someone.
Do you have a response to people who say there was not enough research, there wasn't enough time? We don't know how this is going to act in the long run. I don't know what the long-term side effects are.
No, I do think that the vaccines were developed in an amazingly short period of time, and they're also incredibly effective, much more effective than we thought that they would be. But we had a catastrophe in our hands that had to be dealt with. And from my reading and participating in some of these early studies, no safety corners were cut. It's just that the timeline was really compressed. And that is why we're currently operating under emergency authorization as opposed to full licensure, is because the FDA is still gathering data on people that are being vaccinated. And for example, the side effect that emerged several weeks ago related to the adenoviral vaccines, it's incredibly rare, but it was picked up really quickly, which to me was very reassuring because it means that the systems that monitor safety are well developed and are very sensitive, so that if we do find something, we can stop, evaluate, and then make a decision to go forth or not.
We are being joined by Dr. Anna Wald. She's head of Allergy and Infectious Disease Division, professor of medicine, laboratory medicine, and pathology and epidemiology at the University of Washington. Dr. Wald, some people think that the vaccine will hurt their fertility.
There's this myth circulating on the internet that the vaccine will impact your ability to get pregnant. So that is very clearly not true. Lots of women have gotten pregnant after being vaccinated. And if that was true, that means that also women who've had COVID would not be able to get pregnant. And that is most definitely not true.
Okay.
Yes.
What do you say if people say it's none of your business if I get vaccinated or not?
That's a really difficult one for me because infectious diseases are everybody's business, right? If you live in a society and have contact with other people, then there's no such thing as there's no my business. It's society's business to make sure that we're all safe. So, yes, personally, it's not my business, but I think from a public health point of view, it's very difficult unless you live in complete isolation to say that you're not at risk.
Dr. Wald, what if you're young and healthy and you don't think you should have to get vaccinated? Because, you're young and you're healthy.
Well, I think first of all, we have lost many young and healthy people. I just got an email about a previously perfectly healthy 30-year-old that died of COVID-19. So it does happen. It doesn't happen as frequently, but it certainly has happened, and it is happening right now. Over 250 children in the United States have died of COVID, and many of them were perfectly healthy. So it still can happen. There is some risk, and there is a risk that even if you don't get very sick, you might transmit it to somebody else who might get very ill and might have a poor outcome.
If somebody's already had COVID-19, there are people that don't think they should have to get vaccinated because they've already had it.
That's a really interesting question. The other coronaviruses, so not this particular one, do not give us lasting immunity. And even with this one, there have been cases of people with documented reinfection. So we know that even if you have it once, it doesn't mean that you're completely immune. And there have actually been cases of people getting it the second time and dying with the second infection. They're very rare, but it does happen. So from a safety point of view, I think it's better to get, even for those people to get vaccinated. They're not a very high priority for me, though, because I think they're probably protected for several months and they're at lower risk.
Dr. Wald, even in our modern day and time, there are people who believe that they can catch the flu from getting the flu shot, and thus there are people who believe they can get COVID-19 from the vaccine. What are your thoughts on that?
I'm speechless because neither the flu vaccine nor this vaccine contains the entire virus. So, and you would have to contain the whole virus that could then multiply, right, and infect you. So that's not how these vaccines are made. That's not how the flu vaccine is made. So it's very difficult to address something that is very obviously not true.
Okay. How about my faith will protect me, so I don't need to get the vaccine?
Your faith will protect you?
Yeah. Some people believe their faith will protect them from the COVID vaccine.
Well, I mean, I don't know that the number of people who are churchgoers versus not that have contracted COVID and died is any different. Certainly we hear of people who are church-going dying. It's very tragic. The way I look at it, and everybody's spirituality obviously is different, that, somebody gave us the tools to make these vaccines. So let's put them to the best use we can.
Will we achieve herd immunity one day?
I hope so. I'm not as pessimistic as some other people are, but it does mean that many people will need to be vaccinated, and that includes children. And that's coming. Hopefully this week, the FDA will provide authorization for using vaccines in 12 to 17-year-olds, or rather 12 to 15, 16 and 17 can already get Pfizer. And hopefully by the end of the summer, even younger kids will be able to get vaccinated. On
a scale of 1 to 100, what percentage of the COVID do we know? Are we confident that we know?
That's a wonderful question. I think it depends what aspect of it. I am very confident that these vaccines are very protective. I'm less confident that I really understand long-term outcomes of people having COVID and how quickly they will take to complete recovery. We certainly hear of people who've had COVID who months later are still not back, and that's very upsetting.
Dr. Anna Wald, you are brilliant. Thank you very much for taking a few moments for us. I wish we could have talked and got to know each other better, but I wanted to make sure I got all these questions to you. And now we're out of time. Anna Wald is head of Allergy and Infectious Diseases Division, professor of medicine, laboratory medicine, and pathology and epidemiology at the University of Washington. Dr. Wald, you're amazing. Thank you so much for joining us today.
So much. Bye-bye.
Bye-bye.
Dan Michaels.
I guess I was going about 65 tops.
7 miles an hour.
On the mighty 790 and 104.7 KFGO.
Hi, I'm Steve Johnson with Johnson Auction and Realty. Here's one of our newest listings. 500